Hello everyone, thank you BCRT for giving me the opportunity to say a few things about chondrosarcoma, what it did to me and my family. My name is Nik Kalita. So here's a little bit of background. Born way back when, I spent a number of years in academia until realizing that it wasn't really for me in the long run. After getting my first proper job back in 1992, I realized I really did enjoy traveling, and that job, fortunately, took me in various incarnations to those places with the blue dots. Um, and the purple ones are the ones where I spent some reasonable amount of time, usually more than a year. Married Daniela, we had a daughter, Nicola, and the globetrotting continued for a while. But as you can see, there's not much south of the equator. We had to stop for reasons that I think are pretty obvious. So after jogging along one bright sunny morning, as it always is in Abu Dhabi, I had terrible pain in the groin after getting out of my car, barely hobble into the apartment, and well, it was really not very good at the beginning of a new job. It turned out to be a hernia. Well, that was fixed in due course, but the pain just didn't go away. So we thought it was likely something botched, but no. There was no evidence to support that. After investigation after investigation, I carried on regardless with sports crutches for comfort, and office was very good. That carried on for several months. And after umpteen investigations, Danielle eventually suggested seeing an orthopedic guy. The chief in one of these Dubai orthopedics hospitals was quite relaxed. He said, nah, I'd scrape it out, give you a hip joint and send you home. You're a bit overweight, and that's probably 9/10 of the cause of it. But, protocol dictated he still had to do a biopsy. Duly did, and it came back from the local lab with a lot of medicalese that seemed a bit odd, but not really worrying. I mean, after all, looking at the X-ray there on the left hip, there's nothing there, is there, after all? But anyway, they sent it off back to Prof. Tim Briggs in London. Professor Adrian Flanagan at UCLH did the actual histopathology, sent it to Professor Tim Briggs, and that came to me wrapped inside a pretty blunt email. We're going to have to chop off large parts of hip. It's called the Girdlestone procedure. It will change your life, and there is no option. Now, I was in my early 50s, and I had, until that point, had occasional niggles, been feeling a bit peculiar now and again, of course, like we all do, I suppose. And I had some hints that maybe my body was beginning to be a bit tired of unquestioningly doing everything it was told to, and starting to fight back or break or wear out a bit. But this, completely, well, there aren't words. A lot had to be done immediately, and it was just a to-do list of monumental proportions. What we did next was quite different from the routine NHS investigation and referral system, being of course overseas and having gold-plated insurance. We could just walk into any clinic and request pretty much anything we liked. We took that approach in the UK, viewed it more as a sort of procurement or business decision, really. Having selected and interviewed, as we felt, 3 or 4 different consultants in several different sarcoma centres, we made a joint choice of RNOH. Some of the others were impractical, some we didn't get on with particularly well, and of course we really didn't know what we were doing. If we knew half then of what we know now, things would have undoubtedly gone very, very differently. So I turned up on the 2nd of August. There was 0 pre-operative preparation, no sort of antibiotics or that sort of thing. And next morning I had this enormous internal hemipelvectomy, where everything from an inch below where you hang you treat your jeans to several inches down the femur had gone, and had this enormous prosthesis put in. It was an off-the-shelf piece. We didn't go for anything like fancy, like custom 3D printed devices. That would have taken too long. And I'm told that while I was out, some point during the 8-hour surgery, a lot of jokes about the Terminator were thrown around. Good job I didn't hear those until a lot later. I came to, everything seemed more or less okay at first, and we were expecting a few weeks convalescence, then discharge and learning how to walk. After about a week, it became obvious that things were not going at all well. I was not sleeping properly. I was having raging temperatures, although I felt very cold, and was in a great deal of pain. I had 4 infections, 3 of them methicillin resistant, and several debridements were required. Now, Rob Pollock, who had taken over from my original consultant, who shall remain nameless, said during one of them, I brushed against a vessel and it started bleeding. Healthy tissue doesn't do that, so we patched it up and are going to figure out what to do. At the next attempt, the blood pumped so hard they could hear it spurting out. Heaven knows what the theatre must have looked like. They tried twice to patch up the artery, succeeded on the second time, but they had to take out all that metal work to get at it properly. Mr. Pollock again said, I won't forget that in a hurry, and I'm sure he still recalls it with terrifying clarity. Tim Briggs's prophecy came true. I had the girdle stone, and I wouldn't walk again unassisted. 6 weeks in ITU, mostly in isolation. In that period, twice the doctor on call, the junior doctor, as say, or SHO or registrar, whoever he was, tried to took me out of ITU and put me on a normal ward. It did not go well. On one occasion, I was literally being wheeled out the door, felt something damp on my side, and held up a hand covered in blood. Another time, something else went wrong. I had high fevers and I had to be brought back in the following morning. Somebody in authority must have put their foot down and said, look, don't try this again. You're tempting fate. Keep him in isolation for weeks and keep a damn close eye on this guy, or else there could be some serious trouble. Another 6 weeks later, during which I was transferred back to a normal ward, I was slowly losing my mind, and as soon as it was safe to do so, essentially checked myself out, flew back home. So here we are at the Grand Mosque in Abu Dhabi, where the local garb is mandatory: dish dash for men, hijab and abaya for ladies. That's just at the mosque, not in general, you understand. It's extremely comfortable, in fact, and it's very good for covering up the vac pump that I had to wear, slung a bit like a sort of handbag over my shoulder, chugging away 24/7. That vac pump was linked to a dressing covering an enormous wound, which had in it fluid that was warm, moving around, and a fantastic place for bacteria to flourish, which they duly did, putting me in the ER several times. Pulmonary embolism didn't help particularly. That was an additional risk. Through all this, though, the guys at work were great. They put in all the aids I needed, accommodated my office space very well, and were very reasonable when I caught chicken pox. I had to stay away for a month because it's really not good for young children and pregnant women.
When I was first scanned in June the previous year, there was one so-called suspicious nodule in my lungs that had multiplied to a good half dozen come spring 2016. Now we thought we could have an operation to get rid of the visible lung mets, but what we didn't realize that where there was one visible, there'd be another dozen or so tiny ones. The guy opened me up, palpated my lungs with his gloves, and just found loads. He took out some of the worst, closed up again, and when I woke up, there he was at the bedside. I looked at him, he looked at me, and I said, "I'm expletive, aren't I?" And he said, "Yeah, you are." I've always admired his honesty. So, well, there was nothing for it then. I couldn't stay in the UAE anymore. We just had to pack up, get things in order, leave gracefully, and do what we can back in England with what was left. Now, meanwhile, we had been scrabbling around looking for clinical trials, something that no doctor had ever mentioned the possibility of, but we found out through friends and contacts in the biotech industry. Turned out there was a possibility of squeezing onto a trial for IDH mutations. It so happened that we sent the biopsy samples off to London, and they did have that mutation, opening the door to the trial. So there was some slim hope. Even so, on a trial, I couldn't stay in Abu Dhabi. It was just completely impractical. And in June 2016, we all left. We managed to squeeze onto the trial. So instead of going to the UK, the whole lot of us up sticks and went to Boston, Massachusetts to live for several months in the basement of a wonderful man in the biotech industry who has remained a great friend to this day and has given tremendous amounts of good advice. So after a couple of months, it turned out that these tumors were not halted, but they did almost stop. I could have hugged my oncologist. Well, it wasn't very handsome. Everybody breathed a huge sigh of relief. My family went back to the UK so that our daughter could carry on schooling, restart her schooling in the UK and unpack our belongings from the Middle East. I flew back after a month, but that was a short visit because no sooner had that finished than a whole cycle of monthly trips back to Massachusetts were required for lab scans, new tranches of drugs, and to fill the hospital's coffers out of my own pockets. Remember that this time, although I'd stopped working, and my insurance, although it was worldwide, excluded the US, so that it all came out of my own pocket. This was really a very difficult time.
Over time, the wound site shrank, but underneath it was an enormous cave system full of all sorts of nasties. I had to be dressed regularly, at least daily. I couldn't take a bath, I couldn't swim, that sort of thing. But at least I was getting around on crutches or a walker. From time to time, something would flare up and put me into hospital on intravenous antibiotics for a day or so, but that would clear up. And it became apparent over time that this was gradually getting worse, and these sort of sessions in the hospital were really just putting a lid on it, that underneath it, all those nasties were slowly but surely spreading. I also had other issues, core problems due to all sorts of muscles severed, all sorts of things down south not really working properly, never have since. Yes, moving swiftly on. Meanwhile, and through all this, I was travelling to Boston every month, which was quite an ordeal. But thankfully, the remarkable Dr. Jones, now professor at the Royal Marsden, created essentially a one-man clinical trial for me. So no more Boston visits. Huge relief, even though I'll miss the friends that I made over there.
On one of my regular scans, scheduled at the Royal Marsden, they took one look at me, gave me a Coke can of antibiotics, intravenously reserved a bed, and told me to wait and see while they figured out what to do. Thankfully, all that worked. I was scheduled post haste for a debridement in Nuffield Orthopaedic Centre, which is a lot closer to home. Duncan Whitwell took 4 hours to scrape out infected bones, scarring, soft tissue, and restructured what was left. The subsequent X-ray looked quite remarkable. Really a tremendous improvement on the mess that was there in the first place. 54 staples out a month later, things improved a lot, but there were some little hot patches left, so I was given some fairly powerful antibiotics for 6 months, which worked wonderfully. I had no side effects. Everything settled down after I stopped taking them, and it remained very quiet.
Things in life don't always go to plan, and various events that are well beyond my control, pretty much anybody else's, have caused a great deal of blood pressure elevation and stress. Tipsovo inventory is held in Portugal, and after Brexit, I had no idea whether dysfunctional administration, communications, laws, etc., absence thereof, would interrupt the supply. Aegis manufacturer issued corporate guff, but the Royal Marsden had very good alternative arrangements in place and at that time managed to continue supply. I think I'm the only person in the UK, if not perhaps Europe, taking Tipsova for chondrosarcoma, so it's nice to be noticed. Then, when all the dust had settled, along came the sale of Agios Cancer Arm to Servier, a rather sprawling French pharma company, which has had its fair share of problems fairly recently. Nevertheless, my supply so far has been uninterrupted, and fingers crossed that shall continue.
Time's running short, so I'll leave the left column as fairly self-explanatory, but I have to get up on my soapbox to say something about the right. USA has for-profit medical services. It does not have healthcare, and I'm not joking when I say that Americans that do understand what we have and its cost effectiveness and clinical efficiency would crawl over broken glass for it. In the 2014, the Commonwealth Fund, an independent American think tank, decided it was the best in the world. No more, it's still pretty good, but I urge you all not to take it for granted. Sort out what you can for yourselves, don't abuse the ER, and don't ignore what's happening. For example, the NHS bill of July 2021, which opened the door to yet more creeping privatisation. If we end up anything like the US, where beds basically go to the highest bidder and price gouging is common, it will be to everybody's disadvantage.